Welcome back to next the Diabetic Foot Files. I know people might be tired of me harping on necrotizing fasciitis, but I want it to be imprinted in people's brain not to miss this again. And I've been talking about this for maybe 3 or 4 episodes, but like I said, I was very upset seeing that person during the autopsy by the mortician, and the mortician finding out that, they covered his arm with a cast because he had some arm pain from minor trauma, and it turns out to be necrotizing fasciitis. Okay, and that was something that could have been avoided because the patient went back the very next day after his pain did not get better, and they just put a cast on him, slapped a cast on him. And yes, the X-rays were negative, but they could have done a CT and draw some labs to investigate more. But now that patient died from neck fash because they didn't investigate more. So let's go back into neck fash. But the interesting part about this one is how insect bites can trigger necrotizing fasciitis. So what is necrotizing fasciitis? Yet again, neck fash, a rapidly progressing, life-threatening infection of the deep soft tissue and fascial planes. Bacteria release enzymes and toxins that destroy the fascia and the subcutaneous tissue, causing widespread tissue death, shock, and systemic toxicity. Mortality rate can range from 20 to 80% depending on the promptness of the diagnosis and treatment. And in most cases, it arises from a skin break, whether it's surgical, ulcer, trauma, perforations, or tiny punctures. And like we said, common bacterial culprits usually are group A Streptococcus, Staphylococcus aureus, anaerobes, and gram-negative rod. So, why could an insect bite trigger necrotizing fasciitis? So, insect bites are usually minor puncture. I just got stung by a wasp about almost 4 weeks ago. It was quite painful, and I didn't realize how deep they stung, and it was like really painful along my entire thigh, which is crazy. So, in most healthy individuals, the insect bite usually starts with like itching, redness, and it heals very quickly. But however, insect bite, as we all know, breaks the skin barrier, and that is what we call a portal entry, pretty much a portal entry for the bacteria. And the bacteria from the environment, whether the skin surface or whether it's from the insect's flora, can invade the different tissues because it's a portal entry, right? With that insect bite, because they're puncturing the skin barrier, especially if the bacterial load is high, if the host immune response is weak, such as having diabetes or immunocompromised or suppression, sorry, or local tissue oxygen or perfusion is poor. But once inside, bacteria produce toxins, proteolytic enzymes that digest tissue proteins and damage blood vessels. This leads to ischemia, aka lack of blood flow, facilitating an anaerobic environment, which is perfect for necrotizing bacteria to proliferate. So this is not bite like a venom bite itself causing necrosis. It's secondary to a bacterial infection exploiting the wound. So, what are some clinical cases or examples from the literature about how insect bites can cause necrotizing fasciitis? Okay, so one case, a previously healthy adult developed rapid swelling after a tick bite, progressed to shock, and died within 48 hours. They cultured it was group A beta hemolytic streptococcus was isolated from the patient's tissue. Next, let's do a mosquito bite. So, mosquito bites can secondarily become infected, and with neglect, it can result in necrotizing fasciitis in certain cases, requiring surgical debridement, antibiotics, or even skin grafting. And this is not to scare anybody, okay? It's to knowledge is power, remember? Next, needle insect bites. Okay, there was a 7-day-year-old infant that developed necrotizing fasciitis in their neck after an insect bite. It required early surgical debridement, broad spectrum antibiotics, which were essential for the patient's survival. Next is insect bite that caused necrotizing fasciitis with a septic emboli. So a 21-year-old developed knee necrotizing fasciitis after an insect bite, and I thank God so much with that wasp stain. That was extremely painful. And it was complicated by septic pulmonary emboli, highlighting how localized infection can spread systemically, like seed systemic spread. Next is a spider bite, which we're pretty well versed in. Brown recluse spider bites. There are like series of cases, like even about 31 cases that cause neck fascia patients that show secondary bacterial infection from an envenomation of the wound, leading to necrotizing fasciitis. So underscoring that the bacterial infection of the necrotic venom damaged tissue can set the stage. And hopefully you could understand that these bites are more gateways, right? And the bacteria does the damage. So how does the chemistry of it destroys the tissue? So once the bacteria enters, I would say all hell breaks loose, but the fire starts, right? So the enzymes and the toxins. So streptococcus pyrogenic exotoxins. These are super antigens triggering massive immune responses and tissue injury. Then the proteases. These break down extracellular matrix and fascia. The hydrogenase and the collagen. These promote the spread through the tissue's planes. And then the hemolysins, these damage the cell membranes, causing death. So the anaerobic metabolism, as the tissue perfusion drops due to the bacterial destruction of the blood vessels, oxygen levels fall. So anaerobes thrive, producing the gas and further toxins, making bacteria pneumonia-like processes happen in the soft tissue. And the host response, the immune response, the neutrophils and the cytokines become dysregulated because the bacteria overwhelms the local defense system and often triggers sepsis. We talked a little bit about how necrotizing fasciitis was discovered, but let's go. I always like historical notes as often, but like we said, it was described first in the 18th century. I'm sure it was. Remember we talked about Hippocrates talking about it way back. I bet it always existed, okay? But the bacteria causes elucidating over time as, bacteriology, microbiology advanced so they can understand it better. So early clinicians noticed this rapidly spreading soft tissue infection, lethal without surgery. And forgive me, I just woke up and I have a little bit of a headache. So yeah, we're all human. And in the 20th century, organisms like group A Streptococcus, Clostridium perfringens were cultured from necrotizing fasciitis wounds. And case reports, like we said, like I gave you a bunch of case reports of insect bites that resulted in necrotizing fasciitis. I feel like the interesting one was the 21-year-old and the 7-day-year-old baby that got insect bite on the neck. But you have to be fully aware. But the concept that insect bites can stage this from careful forensic cases analysis and retrospective reviews. So we always have to keep that in mind. And I feel like sometimes insect bites might be also quite hard to diagnose, especially in people with neuropathy because they will not remember. They don't feel it. Like we can feel when an insect bite happens if you have normal protective sensation, but also sometimes you can just wake up with it, right? And you wonder, what is that? I haven't seen any insects around. I mean, who hasn't been bitten by an insect? We all have, right? But because of our health systems, it's able to fight that portal entry of bacteria from that insect bite. So what do you look for again to see if the patient has necrotizing fasciitis and never downplay patient's pain. Pain out of proportion on physical findings. I know everybody, when they hear pain out of proportion, especially on the podiatry aspect, we think compartment syndrome, but you should also think neck rash. Could it be neck rash, right? Rapid spread of redness and swelling, skin discoloration, dusky and bluish, bullae, the blisters formations, crepitus from the gas forming bacteria, and systemic signs like fever, tachycardia, and hypertension. And remember the LRINEC score, which is a lab risk indicator to help stratify the risk. Elevated white blood cell count, CRP, lactate. Get an MRI or CT may show fascial fluid gas. But like we said, if the X-ray is negative and you're still wondering, you want to make sure CT, get a CT, get a CT, get a CT. So biopsy and culture guided antibiotic therapy, okay, but early differentiation from a benign post bite swelling or cellulitis is critical. Sometimes they have to even do a tissue biopsy. So how do we fix neck fasciitis again? Emergency surgical debridement is always, the gold. I would say kind of pretty much the gold standard, and removal of all the necrotic fascial tissue until healthy bleeding tissue remains. They usually have to do serial debridements when it comes to neck fasciitis. Broad spectrum IV antibiotics against gram-positive, gram-negative, and anaerobes, and then they tailor the antibiotics once the culture is returned. Blood supportive therapy like hydration and oxygen support, hyperbaric oxygen in select cases to improve oxygen delivery and inhibit anaerobes because they do not like oxygen. And early recognition saves lives from necrotizing fasciitis because to delay longer than 24 hours between onset and debridement increases mortality rates dramatically. But like I said, we talked about the key journal articles, the tick bite that would lead to fatal neck fash, the mosquito bite resulting in neck fash, the neonatal neck fash after insect bite that complicated neck fash and causes systemic emboli, and the brown recluse spider bites with secondary infection leading to necrotizing fasciitis. Like I said, these are all rare, but confirming the mechanics and the consistent pathways from a puncture wound to bacterial infection that can cause necrotizing fasciitis can help save a life. So insect bites themselves do not produce necrotizing fasciitis, but the bacterial invasion after the bite does. Necrotizing fasciitis is a surgical emergency requiring rapid debridement and antibiotics and early diagnosis and recognition. And like I said, just get a CT, draw the labs, do the lactate, the CRP, the white blood cell count, okay? And always, I would say, always maintain a high index of suspicion for rapidly spreading pain and systemic symptoms because we would love to save a life and not say oops and make mistakes, okay? So thank you for listening to Diabetic Foot Files. Sorry for all the flow of today's episode. But like I said, we are all human, and the whole point is to save lives. So if you're a clinician, and so a lot of people think necrotizing fasciitis is very, very rare. But like I said, if you're in wound care or in the ER, you'll learn that it's common enough. It's common enough. And if you're a patient or caregiver, seek immediate care if your wound is rapidly becoming worse or there's pain out of proportion. And this is Diabetic Foot Files with Dr. G. And take care of your feet because they take care of you.